Good morning. I'm going to talk about Ozanimod induction and maintenance treatment of ulcerative colitis. The definition of Ozanimod is an oral agonist, the sphingos 1 phosphate receptor subtypes 1 and 5 that induce peripheral lymphocyte sequestration, potentially decreasing the number of activate lymphocyte circulation to the gastrointestinal tract. This is a video of ulcerative.
Inflammatory bowel disease can cause inflammation in the small and large intestine. In other words, inflammation of the bowel. Colitis refers specifically to inflammation in the colon, or the large intestine. Ulcerative colitis is a type of inflammatory bowel disease that tends to form ulcers along the inner surface or lumen of the large intestine, including both the colon and the rectum. These ulcers are spots in the mucosa where the tissue has eroded away and left behind open sores or breaks in the membrane. Sometimes there's a flare, which means that new damage has occurred, and then there are periods of remission when the tissue starts to heal up. Ulcerative colitis is actually the most common type of inflammatory bowel disease. Not that there are that many, but this one causes inflammation and ulcers in the mucosa and submucosa of the large intestine only, which is an important point that sets it apart from Crohn's disease, another inflammatory bowel disease. Now, although certain environmental factors like diet and stress were once thought to be the culprit behind these ulcers forming in the gut, now it's thought that these are more secondary, meaning they seem to make the symptoms worse, but ulcerative colitis is now ultimately thought to be autoimmune in origin. In fact, cytotoxic T cells from the immune system are often found in the epithelium lining the colon. So the thought is that inflammation and ulceration in the large intestine is caused by T cells destroying the cells lining the walls of the large intestine, leaving behind these eroded areas or ulcers. It's unclear what exactly these T cells are meant to be targeting, though. Some patients have P ANCAs in their blood, or paranuclear anti-neutrophilic cytoplasmic antibodies, which are kind of antibodies that target antigens in the body's own neutrophils. Although not completely understood, some theories suggest this might be partly due to an immune reaction to gut bacteria that have some structural similarity to our own cells, allowing antibodies to those gut bacteria, or P ANCAs, to cross-react with neutrophils. Patients also seem to have a higher proportion of gut bacteria that produce sulfides, and often high sulfide production is correlated with periods of active inflammation as opposed to remission. Ultimately, though, these are mostly correlations and theories, right? And we've yet to nail down the precise mechanism behind mucosal destruction. The cause is ultimately some combination of environmental stimuli, perhaps the sulfide-producing bacteria, mixed with a genetic predisposition, because patients with a family history of ulcerative colitis are more likely to develop the disease themselves. It also seems to be more common in young women from the teens to their 30s, with more prevalence among Caucasians and Eastern European Jews. With ulcerative colitis, the pattern for ulceration seems to be circumferential and continuous, meaning that the inflammation goes around the whole lumen and starts in the rectum and continues along the large intestine without any apparent breaks of normal or unaffected tissue, like it's working its way from one end to the other. As more damage is done to the tissue, patients experience pain in the left lower quadrant, which corresponds to the rectum, and more severe and frequent bouts of diarrhea, sometimes with blood in the stool as well. As the mucosa and epithelium are destroyed, blood and serum may be released into the lumen, which contributes to the blood seen in the stools. But also, what's one of the main jobs of the large intestine? It's absorbing water, right? As these cells are destroyed, the large intestine can't perform this function as efficiently and ends up letting too much water through, contributing to diarrhea. Treatment for ulcerative colitis depends on the severity of symptoms. Often anti-inflammatory medications are given, like sulfasalazine or mesalamine. In more severe cases, though, drugs that suppress the immune system, like corticosteroids, azathioprine, or cyclosporine, might be prescribed. Finally, if these treatment options fail, sometimes a patient will have a colectomy, which is a surgical removal of the colon. Since the disease only affects the large intestine, removal of the colon generally cures the disease. But you have to weigh the benefits of curing the disease against the total loss of the large intestine.
Application in medicine. 197 adults with moderate to severe ulcerative colitis, patients were randomly assigned to receive Ozanimod at a dose of 0.5 mg or 1 mg or placebo daily for up to 32 weeks. The Mayo Clinic score was to measure disease activity on a scale from 0 to 12, with higher scores indicating more severe disease. Scores range from 0 to 3, with higher scores indicating more severe disease.
What is ulcerative colitis? Ulcerative colitis is a chronic condition characterized by inflammation and sores or ulcers in the rectum and colon or large intestine. Ulcerative colitis can be distinguished based on how much of the large intestine is involved. When ulcerative colitis involves only the rectum, it is referred to as proctitis. If the left side of the colon is involved, it is known as left-sided colitis. When the entire colon is involved, it is known as pancolitis. Ulcerative colitis is characterized by periods of time with active inflammation when the patient is experiencing symptoms, and periods of time when the inflammation is turned off and the patient feels well. We call these periods of wellness remission. Many patients with ulcerative colitis have long periods of remission, alternating with periods of active inflammation, which are called flares. Some patients with ulcerative colitis have more severe flares than others. Although the cause of
Pros and cons. The rate of clinical remission was 21% in the group that received 1 mg of Ozanimod, 26% in the group that received 0.5 mg of Ozanimod, and 6% in the group that received placebo. This is an interview in the Mayo Clinic.
My name is Ed Loftus. I'm a physician at Mayo Clinic, and I'm chair of the Inflammatory Bowel Disease Interest Group here in the Division of Gastroenterology and Hepatology. And I wanted to talk to you today about ulcerative.
YouTube. Issue plan Ecuador with this drug may reduce the number of cases in Ecuador with 1 mg that or drugs, how we can see in the clinical test.
It is commonly believed that there is no known cause or cure for ulcerative colitis. In this episode, we're going to blow the lid off that myth and show how it's caused, how it's cured, and why you probably haven't heard anything about this. Hydrogen sulfide, as they're digested by the gut bacteria. Hydrogen sulfide is extremely toxic to the human body.
This is the same symptoms of the first video. In conclusion, in this preliminary trial, Ozanimod and daily dose of 1 mg result in slightly higher rate of clinical remission of ulcerative colitis than placebo.
The goals of treatment are to control the acute attacks, prevent repeated attacks, help the colon heal. Hospitalization is often needed for severe attacks. Your doctor may prescribe corticosteroids.